But first, let's go to Linh-Vi, who is the acting manager of the Department of Health Office of Medical Cannabis Control and Regulation. As an epidemiologist, you've been asked to do a tough job as you're managing the office. We look forward to your presentation. You can tell us more about how it's going. Please proceed.
Thank you for understanding. Good afternoon, Chair, Vice Chair, and members of the committee. First of all, Happy Lunar New Year. Chúc mừng năm mới. That's in Vietnamese if you're wondering.
Thank you.
So thank you for the opportunity to present OMCCR's work. We were asked to give also an overview of the staffing and our budget as well. I'd like to begin with our mission, which is to ensure safe access to medical cannabis and promote public health and safety for cannabis and hemp-derived cannabinoid products as well. To achieve this, we prioritize fast and efficient patient registration to ensure timely access to our medication. Our registry team processes the 329 patient cards within 2 to 3 business days, often within 1 day. We also advocate for patient well-being by engaging with the community. We survey patients and hold listening sessions with providers to help us inform the rules and also our legislative proposals. Our dispensary licensing team is committed to ensuring cannabis and cannabinoid product safety. They have dedicated significant time to addressing multiple bills and acts. Recently, the team completed the hemp rules and is returning their focus to completing the medical cannabis rules, all while conducting 180 to 200 inspections annually. The office recently completed a reorganization to add a surveillance, education, and science section. We have established an adverse event reporting and response system, along with other public health surveillance. We are providing in-person education about medical cannabis to our patient community and working to bringing continuing medical education to Hawaii's licensed healthcare professionals. The team conducts studies to support informed decision-making, including a market demand study, which will help inform your decisions around adult use cannabis legislation. So I was asked to talk a little bit more about this. What we've done is we've engaged a public policy consulting firm to independently assess Hawaii's medical cannabis licensing regulatory framework, but also mainly to predict the demand for adult use. And this will be, they're conducting surveys among the residents of Hawaii in a market research panel, and as well as among tourists and of farmers as well, who may be looking, in order to provide information, on the taxation levels impact on the revenue, the gray market share, the licensing needs that current farmers have, and the effects on medical cannabis program and public health and the environmental health as well. We expect that the market demand report will be available to you by mid-March, and are working to try to facilitate to make sure that these surveys actually will happen on time and be able to provide you that data. So our staffing is organized by 3 key functions I just covered. We have 19 established positions and will be 32 in total with the completion of our reorganization. The registry team is fully staffed. The dispensary team will have a new hemp unit to enforce hemp cannabinoid product regulations. We had to reassign 2 of the dispensary surveyors to handle hemp responsibilities when hemp was brought under OMCCR. For the surveillance, education, and science team, we are acquiring the expertise needed to ensure that chemical, occupational, and environmental health safety standards are there. In recent years, we receive about $2.5 annually in special fund revenue from patient registrations and dispensary licensing fees. So you can see in the pie chart there, that before the increase in licensing fees, about 80% of the revenue were from the patient registration. Now the revenue is balanced between patient registrations and dispensary licensing. We are working on a budget of about $2.1 million in expenditure in current years. We have been appropriated general funds to cover most of the personnel and operations costs. So we have a cash balance of approximately $11.6 million. Our office was set up to be self-sufficient, so our projected future use will be to supplant the general funds with the special funds. Once at full staffing capacity, we will be able to apply the accrued revenue to for enforcement activities to address the growing number of retailers carrying prohibited products. We have already begun to collaborate with law enforcement on this. Staffing of the hemp unit will provide the bodies needed to educate retailers on what is prohibited and to work with law enforcement to identify and remove the prohibited products. There will be costs associated with this. They include product testing, engaging the prosecutors, embargoing products, and ongoing surveillance. We are requesting access to the funds to ramp up our education efforts. These were included in our budget request last year, but they were not approved, and so we are requesting them again this year. We have begun and will expand medical education for healthcare professionals. Less than 10% of medical schools in the US is teaching about the endocannabinoid system, which is the largest signaling system in our body, and how medical cannabis works to help balance that system. So what we're trying to do with the continuing medical education is to have more physicians, nurses, and healthcare providers to know how cannabis works so that they can help, so they are informed in their clinical care and support to not only the medical patients, but also to other users as well, who maybe not be medical patients, but are using, and there are implications with using and drug-drug interactions as well. Our patient survey shows that more of our patients rely on dispensary retail staff than their providers to help them choose their medication. So we will also equip retail staff with skills to help patients without recommending medications. There will not only be youth cannabis use prevention campaigns, but also public education so that adults are aware of the potential risks of cannabis as well as hemp cannabinoid products. Many are not aware, for example, that even the non-intoxicating CBD have cannabinoid drug interactions, with prescriptions, but also over-the-counter drugs. And we would like for the public to know that. Public education efforts are costly. Other states' annual campaigns cost about $1 to $2 million. We have a youth campaign that's starting under our ADAD program for $1 million. So while they're costly, they are very critical. Education is needed now, even before adult use, because our population-based surveys are showing that 11 to 12% of our general population are already using or have report to use in the past month. Finally, we welcome the opportunity to work with a legislator to ensure that the medical patients are protected under the Adult Use Bill. In addition to the providers listening sessions that we're holding, we're also planning to do patient outreach in their communities and hold listening sessions with the patients and get their input to ensure their safe access. Before I end, I would like to bring your attention to 4 bills which we would like your support, including 3 for hemp, covering minimum age requirement, the definition of manufactured hemp products, and registration requirement. We also propose that the one-to-one patient-caregiver relationship includes caregivers' ability to cultivate, given that there are patients who cannot grow and who do genuinely need their caregivers. Because some of them do not purchase from the dispensaries for various reasons. 2 very important support we need are extensions to the medical cannabis interim rules. We continue to need the flexibility to adapt to the changing cannabis landscape, we have also received requests from the licensees for changes to the rules. Most urgently, our 6 dispensary positions are expiring in 5 months, and we request that their positions be extended for at least another 2 years. So our legislative liaison is helping to identify the sponsors for these extensions. Thank you very much for your attention. The office's staff are here as well to help answer any of your questions.
Thank you, Dr. Lay. Very much appreciate your overview of the